On Fasciablaster fam, Jasenia here. I'm here to make a quick video on how to fasciablast and cup the abdomen. So if there are any questions after the end of this video, please leave your comments below this video so I can get back in there and answer your questions if I miss any questions as I'm showing you how to treat your abs. So let's get started. So I'm gonna start with a little bit of Ashley's oil. I put it in this little container because it's easier for me to not get it everywhere. So here we go. So let's lubricate our abdomen. If you want to throw in a little bit of the love handles as well, you can do so. A little bit more. I like to lubricate the area very well because we'll be doing a lot of manipulation. You can do the back as well. So whatever you really do on one side, you always want to do it on the opposite side too, because remember our fascia lines run front and back. Okay, so if you're going to open this area, open the back as well, so everything is nice and balanced. Okay, so I'm going to teach you how to, I'm just going to use maybe 4 cups. I don't want to overdo it. I want to keep this as simple as possible for all of my ladies. So let me place a few cups. Always cup, never cup in the middle of your navel, okay? Always keep them above or below your navel, never over your navel. Okay, you can do 1 or 2 pumps, whatever works for you. Apparently I need more pressure because they come off so easily. Okay, beautiful. I can keep them on. All right, just like that. And I like to slide them. You can slide them if you want. If that's how you want to prep, you can prep by sliding your cups. Ooh, I feel lots of crunchies. Lots of crunchies. This actually feels really, really, really good. If you have scar tissue in your abdomen, like my C-section mommies, just be very gentle around that scar. Okay, because for some women, it's very sensitive. For others, it's pretty tough skin. But you always want to approach scars with gentleness and TLC because it's trauma to your body. So you always want to be gentle. Okay. I feel a lot. My tissue is really stuck in this area right here. I can feel it. If you just want to use 1 cup, you can. You want to use 2, you can. But let's stick with 1 if you just want to use 1, okay? And abdominal cupping will stimulate your digestive system. The abdomen for me is one of those areas that are very sensitive, especially for detoxing. If you're releasing a lot of emotional stagnation in this area. So for some ladies, you may feel moody, crying can happen. It's all emotional detox. So the abdomen is just one of those areas that I like to treat once a week. I don't treat it back to back. I let my body recover the best that it can after an abdominal treatment. It's very powerful, very powerful. So I allow it to do its thing for, you know, that week, for it to heal, to recover. And you just keep doing this, prep the skin until, you know, you've reached from one end to the other. Oh, these lateral fascia lines for me are very sensitive, the laterals. And you can take it back, take it all the way back to your back. And slide it. If you have issues with your shoulder, your range of motion, use your tube. This guy comes in handy. Okay, if you need help with pumping that cup, okay, that comes really in handy, okay? I happen to be very flexible on my shoulders. Not so bad. I was not always like that. As you saw my picture yesterday, my before and after picture, when I first started using the fascia blaster, I had a lot of bound tissue in my shoulders. Keeping the treatments simple is the best way to go. Don't overcomplicate your treatments, okay? Keep them simple. I like to keep them simple. It just keeps me motivated to stay consistent. So just, if you want to just use one cup, just use one cup. If you want to use two, that's cool too. So I'm using the vacuum cup. I feel a lot going on in my hips, right in here. So you can always leave the cup stationary and mobilize through movements. Okay, you can go from side to side. You can go twist at an angle. Open up those fascia lines. Dexter saying hello to everybody. Doing a downward dog. Downward facing dog. Just move. The body likes movement. Okay, if you need to bring your yoga ball in, you can bring your yoga ball in and do some mobilization, move those hips. You can do that too. Okay. Have a lot of amazing tools you can use and be creative, all right? So yes, I have a lot going on here, right in here. Oof. Everybody's gonna be different. If you do feel nauseous during your abdominal treatment, it is normal, okay? If you're not, if this is like your first few times treating your abs, it is completely normal to feel nauseous and a little weird, moody, emotional, like you're PMSing. Completely normal. I'm sure a lot of our fascia blasters can give their insights on how they felt when they first started treating their stomach. For me, I could speak from experience, from my own experience. I was very nauseous, moody, gassy, because you're stimulating digestion, you're moving things along the way in the digestive tract. Okay, so that's why you kind of want to approach your stomach with baby steps, little by little. So I have a lot going on in my hips here. So I'm just going to leave this one stationary, and I'm going to mobilize range of motion. Like that. You can always practice also with your pelvic tilts. So this is an anterior pelvic tilt. So this is, pretend your pelvis is like a bowl of water, okay? So when we're in an anterior pelvic tilt, your water's flowing forwards. When you're in a posterior tilt, your water's going backwards, okay? So you can practice anterior and posterior. So anterior, posterior to get those hips moving, okay? But you always want to find your neutral position. So in order for you to find your neutral position, you have to do the wall test. We discussed that the very first day, the wall test, okay? So keep in mind you have 2 fingers lower back, 4 fingers in your neck when you're standing against the wall, all right? So mobilizing hips is huge. Making sure you're not locked up. Okay? So mobilize anterior, posterior, anterior, posterior. Okay? Get these lateral lines. So I'm going to keep this right here because I feel very stuck here. And I'm just going to move side, 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 side. You can do 10 reps, okay, 10 repetitions. I do 1 set of 10 repetitions just to open up the area, get the blood flowing. Don't forget to breathe. Diaphragm is very important that we stimulate the diaphragm. Diaphragm also is a muscle, okay, so it helps aid digestion as well, okay? So you always want to make sure you fill up that diaphragm. So I'm going to go in an angle and stretch. Good, and come back. And I'm going to keep sliding the cup till I reach my back. Very sensitive here. And if you feel tightness in your lower back, you can also use your yoga ball to mobilize, just like that. And bring your yoga ball a little closer to you, and bend, and bend, and mobilize that lower back. I feel a little tightness in there, right there. I'm just starting to feel a little bit better. I still have a little bit of congestion. I'm fighting a lot of like sinus congestion. But of course with fasciablasting, I help move it along. So some days I have good days, other days are not so good. But you know what? We gotta keep going. Gotta keep treating ourselves. And do 10 reps of these if you feel like your lower back is tight. Okay, and once you've finished cupping that area, you can start with your prep tool. I love to use the mini paddle. This is my prep tool of choice. You can also use the Master Blaster or the Paddle Blaster, but I have more leverage with Me personally, I'm more leverage using the mini paddle. So that's why this is my tool of choice right now. Again, fascia blasting also stimulates digestion, stimulates the movements, your bowel movements, and anything that can remain stagnant or stuck within your digestive tract or in your tissues. You can also use your yoga ball to help stabilize you as you're treating your abdominal area. So you can use it just like that and extend and try to relax your neck. Don't strain your neck. Okay, you can also use your yoga ball to help stabilize you as well. If you want to open up that area a little bit more. Okay, that's a tip right there. You could also use it to treat the sides as well, just like that. Love handles. And then you repeat the other side as well. So let me get on this side. This yoga ball is so helpful. I love it. It's made out of a nice sticky material, so it allows you to stabilize yourself and you don't slip off. So a nice prep of your tissue. All right. I also like to use the face blaster for my face blaster sisters who like to use this little guy everywhere. You can also treat your abs with your face blaster. So you see that I'm going in an angle. That's the diamond technique. And you can you can also activate your abdominals, so you can tighten it, fasciablast, and relax. Tighten it, fasciablast, and relax. Don't forget to breathe. And tighten it, fasciablast, and relax. Tighten it and relax. Tighten it and relax. So you can do 10 repetitions of that. I like to do one set, and then I like to blast my sides here. And my back. Keep the areas balanced. Just like that. Ooh, I feel it. All right, and there. My hips. get into my intercostal spaces too as well, because then they tend to stick, you know, so you want to open up that area as well. And I just want to show you how you get into your ribs. Right into your ribs. Don't dig. Light and brisk. And the more you fasciablast, the more your body allows the tool to get in deeper. Just like that. So here I like to cup. I'm going to use the silicone cup now. Or you can use the vacuum cup if you want to too as well. So I'm just going to go downwards, right towards my lymph nodes. Try to flush the area. Very sticky up here. And then we'll do the other side. This is the silicone cup I'm using is from globalcupping.com. You can visit my Instagram on my link tree. I have the link on there so you can purchase. You can use my discount code JackLMT to save 15% off your order. And I absolutely love these cups. They're medical grade cups. They're not made out of cheap material, out of cheap silicone. Cheap silicone cups change color. They become like this yellowish color. We don't want that. We want a good silicone cup. Okay. Just like that. I like to work it down to my lymph nodes. Down. 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 And you can also do movement with the silicone cups too if you want. Just like the way I did it with the vacuum cups. Twist, twist, side to side, down and back, down, back, forward and back, forward and back, to help open up those tissues a little bit more. Okay, and then once I've done that, continue moving the blood flow. I get in with a massage tool, and again I use the diamond technique here. On the other side. You can also keep yourself hydrated in between your fascia blasting sessions. Make sure you drink water to help further hydrate your tissues while you're fascia blasting. Because remember, by stimulating your tissue, that's how your tissue hydrates. You can drink all the water that you want, but your tissues won't be hydrated if you don't push that tissue to hydrate. So by fascia blasting, we are hydrating our tissues. By doing yoga, we're hydrating our tissues. Anything that puts pressure in your tissues to get that water into our cells. Just like that. Get a nice reaction. We're getting a nice reaction. And we work to the back. If you feel like you need to use a longer blaster, you absolutely can. If you feel like you don't have the mobility here, you can certainly use a original fascia blaster, a Big Daddy, a Savage blaster to help you get that leverage in. Get into those hips. All right. So now we're going to move into a refining tool. So I like to use the nugget from the OMG blaster set. So we go in and scan where we have tight, sticky tissue, like ropey. It feels ropey. Right in there, have it right over my hip area. So I just use the nugget to spot treat. Just like that. Be gentle, do not dig. And just follow along where you feel the stickiness. Just like that. So I actually feel it all in here in the front. Just like that. And it's starting to get a little bit of black and blue already. Woo. And then you can also use your cup. Use your cup to scan where you feel sticky, so you can go in there and further work on that tissue. So I have more. Oops, I have more right here, just like that, right along the hip here. Ooh. Free your fascia. Free your fascia. This feels amazing. It hurts, but it feels amazing. I'm not going in deep. I'm just going there nice and light. Talk to your body. Say, release, tissue, release. You are safe. You are okay. Let go of what no longer serves you. All right, body? Let go what no longer serves you. All right. Yes, 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 yes. And then As we finalize our treatment, put a little bit more oil in your hand. Say thank you to your body for allowing you to treat it today and get things moving. So I always like to massage towards my lymph nodes. Remember, your lymph nodes are clusters right here, your beautiful lymphatic system. I will certainly get into lymphatic system. I'm always talking about the lymphatic system because that is our waste management. They're the ones that take care of getting rid of the trash and things that no longer serve us in our body. Okay, so we are going to flush into that lymphatic. These awesome fascia blaster treatments, especially in our abdomen, really gets things moving. I can feel the heat. Do you feel the heat? Feel the heat. So just flush. You can use your hands or you can use your paddle blaster, your mini paddle blaster to flush. And this is an amazing scanner too. It allows you to scan for sticky tissue. And it also helps flush things out. Just like that. I'm going to do the other side from here as well. That. Awesome. And just like that, we have completed our abdominal fascia blasting session. Thank you guys so much for joining me. If you have any questions, please leave them in the comments below. Have a beautiful day.